All right, well, good morning, everyone. My name is Dr. Mark Lasician, and I'm the Deputy Chief Medical Health Officer for Vancouver Coastal Health. To begin with, I'd like to acknowledge that we are holding this event on the traditional and unceded territories of the Musqueam, Squamish, and Tsleil-Waututh nations. I'd also like to acknowledge that Indigenous people have been disproportionately harmed by the illicit drug toxicity crisis. This morning, myself and representatives from Vancouver Coastal Health, Providence Health, and the BC Centre on Substance Use were privileged to hold a roundtable discussion with the Honourable Chrystia Freeland, Canada's Deputy Prime Minister and Minister of Finance. We discussed strategies we have been using to address the illicit drug toxicity crisis that continues to devastate communities across this province. We also shared some of our challenges and barriers that we face in our efforts to turn the tide on this ongoing public health emergency. This week's 2023 federal budget announcement shows the federal government's interest in improving timely access to equitable mental health and substance use services. Of note for me is their interest in scaling up access to safer supply and evaluation of these innovative programs. As public health leaders, we recognize that there's a significant need to offer a regulated alternative to the toxic drug supply in order to decrease the risk of overdose in BC. Here in Vancouver, we have benefited tremendously from our partnership with the federal government. Examples include the establishment of Insight, the first supervised consumption site in North America, almost 20 years ago. Okay.
Pardon me, folks.
Okay. So here in Vancouver, we have benefited tremendously from our partnership with the federal government. Examples include the establishment of Insight 20 years ago, North America's first supervised consumption site. Fast forward to today, we are collaborating with the federal government on SAFER, a prescribed pharmaceutical alternative programs for people at highest risk of overdose in Vancouver. Evidence from this program is being used to inform prescribing practices of fentanyl-containing products. These milestone investments have enabled us to innovate and expand the services we offer to people who use substances. We look forward to exploring further partnerships and opportunities for collaboration with the federal government to improve the health and quality of life for people who use substances in our region. Now I'd like to invite the Honourable Chrystia Freeland to the podium to speak to the substance use investments in the 2023 budget. Thank you.
Okay, thank you very much, Mark. Thanks, everyone who's here. Okay, good morning. First, I'd like to acknowledge that we're gathered on the unceded and traditional territories of the Musqueam, Squamish, and Tsleil-Waututh nations. And I have to say, I am really, really glad to be here today in Vancouver and to have had the chance to talk to, but actually mostly listen to, the incredible people at the Three Bridges Community Health Centre. Community health centers like this one are essential to keeping Canadians healthy, and health workers like the ones I had the privilege to hear from today are on the front lines of our public health care system. And I just really want to say to everyone who I heard from today, to the people who are here with me, I really, really value what you do. The government really, really values what you do. I know that all Canadians really, really appreciate and admire and are grateful for your work and the care that you give all of us every single day. And so I just really wanted to start by saying to the healthcare workers I met today, you do a really hard job, you do a really important job keeping the people of Vancouver safe and healthy. So let me just start by saying thank you very, very much. En tant que ministre des Finances, je sais également qu'un système de soins santé publique solide et efficace est essentiel pour notre économie. Notre économie repose sur une main-d'œuvre canadienne forte et en bonne santé. C'est pourquoi l'un des principaux piliers du budget que j'ai présenté cette semaine consistait à renforcer notre système de santé publique universel en réalisant un investissement global de de 198 milliards de dollars dans les soins de santé publique que le Premier ministre a annoncé le mois dernier. Here in BC, this additional investment means an additional $28.5 billion for public health care over the next 10 years. That's $28.5 billion to ensure British Columbians have access to family doctors and nurse practitioners, to provide better access to mental health services, to tackle the unacceptable backlog of surgeries, and to ensure that every single person in this great province, in beautiful British Columbia, receives the care they need. And just as we reinforce our public health care system, we're also extending its reach. With a plan to provide dental care for millions of Canadians, we will ensure that no one has to choose between paying the bills and taking care of their teeth. Today in Canada, you can tell the size of someone's paycheck by their smile. That's wrong, and we're going to change that. On top of these historic investments in public health care, we're also delivering nearly $360 million to combat the opioid crisis that has devastated so many of our families and communities across Canada. That's what I heard about from amazing, compassionate, hardworking healthcare providers this morning. And I'd just like to say that this really is a crisis. And it's a crisis that touches so many of us in Canada. And it really is essential for all of us to act. I know how hard everyone here is working. The work you do here saves lives. And more Canadians need access to harm reduction services like the ones you provide here at Three Bridges. The new funding will mean more than $1.1 billion in total funding for the Canadian Drugs and Substances Strategy since 2017. And that's because we know that harm reduction and a compassionate and evidence-based approach to this crisis is absolutely essential. And I have to say, I heard so much about the importance of that approach from the really heroic people I listened to this morning. By funding community-based supports at places like this, by tackling substance abuse among young Canadians, and by cracking down on drug trafficking and working to cut off the global supply of these devastating substances, we will help save lives here in Vancouver, across BC, and across Canada. Our government is investing in healthcare because it matters to Canadians. It matters to our children, to our parents, to our friends, and to our neighbors. Because it's critical to building healthier, safer communities across Canada. And because British Columbians should be able to rely on a world-class, publicly funded healthcare system, one that is deserving of its place at the very heart of what it means to be Canadian. So thank you very much, Mark. Thanks to everyone who's here, and I'm ready to answer your questions.
Bonjour, merci d'être venu. We'll take questions now from the media. One question, one follow-up. If you could just state your name and your news organization before posing your question, that would be very much appreciated. If people need to stay with their cameras, maybe you can just raise your hand one at a time. Yeah, sir.
Si on peut avoir un résumé en français, s'il vous plaît, des chiffres de l'annonce.
Ah, les chiffres de l'annonce. OK. Oui, j'ai compris. Alors, on était ici pour souligner, premièrement, les investissements qu'on a fait dans les soins de santé au Canada. On a annoncé en février que le fédéral va investir 198 milliards de dollars dans les soins de santé. En particulier, ici, aujourd'hui, nous avons parlé de la crise des opioïdes et on a discuté l'investissement additionnel de 360 millions de dollars dans les programmes comme l'excellent programme qui est ici. Avec cet investissement, le fédéral a investi, commençant en 2017, 1,1 milliard de dollars dans la crise des opioïdes et des autres drogues.
Do you have a follow-up, sir?
Hi, I'm asking this question for research money. There are two different tangents here. So the first one, with this funding that you're announcing, the $28 million, what types of partnerships with various groups, like community groups and research organizations, do you anticipate coming out of this investment?
So I think the important thing is the announcement that the money is there, and we're now going to be working with groups and communities across the country, with researchers and communities across the country, with doctors and healthcare authorities across the country to specifically determine where the money is going to go. And I do also want to point to the really important work that my colleague, Minister Carolyn Bennett, and my colleague, Minister Jean-Yves Duclos, are doing and will continue to do in this space.
I see. And this question is unrelated. It goes back to yesterday when you were speaking to the Greater Vancouver Board of Trade about Canada's performance in relation to OECD countries, and you expressed a lot of confidence that the transition to the clean economy would mobilize the business community like you want to, and also help achieve economic growth. So what gives you the certainty that that there will be those investments and the economic growth?
Okay, that's a very big question, and I could probably spend like 2 hours answering it. I won't, though, because I don't think you guys would like me to do that. Let me just say this. I am very aware of the challenges Canada faces. I've spent this morning having actually quite an emotional conversation about the opioid crisis and the particular very painful challenge for many, many families across Canada that is posed. I'm also aware of the challenge many Canadian families are facing right now with affordability. So we definitely need to be aware of the problems and the challenges many people in Canada are facing right now today. Having said that, I am really, really optimistic about Canada's future. I'm really, really optimistic about the potential of our country. I'm optimistic because, one, we have the people. Canadians are the best educated in the OECD, and we are a country that welcomes immigrants and that is good at it. So that's one of our strengths. Second strength, our natural resources. And right now, with the clean economy transition and with the decision the world's greatest democracies have made that they don't want to rely on dictatorships for their supply chains anymore, that puts made in Canada products at a premium, and that is a huge opportunity for us. And then the third thing that gives me real confidence in Canada is we have a tremendously strong manufacturing and resource base right now. In the budget, we put forward an $80 billion government investment plan in the clean economy. And that plan, plus all the advantages Canada has right now, I think really means that in the 21st century, Canada has everything it takes to own the podium. And by the way, we had some strong first quarter GDP figures this month, much stronger than economists were predicting. 0.5% growth in January, 0.3% growth in February, on track for 2.8% in the first quarter. So, thank you very much to all the hard-working Canadians who are really doing a great job.
Thank you.
The gentleman at the far end, please.
Hi, I'm Eric with City News. Got a question from a reporter. So in your federal budget, you announced that you will be backing the flood insurance, basically because the insurance company refused to pay them out during the November 2021 floods. Can you explain how this program will work when it comes in effect and how farmers and others can access this coverage?
Okay, that is an excellent question because I think across the country, and particularly here in BC, people know that climate change is real because they're experiencing it in their lives, on their farms, at their homes. And so in the budget, the government is taking historic steps to improve the flood insurance that is available to Canadians, to help Canadians understand what their exposure is to flood risks. Details of the program are now going to be elaborated, but the important thing is that there is money there to do that in the budget. We recognize that this is really important for Canadians, and we look forward to working with provinces, municipalities across the country. Thank you.
Thank you. Thank you so much, Nick Amaya from Global BC. This is on behalf of Emily Lasseting. On the Rogers Shaw deal, Minister Champagne pitch, it's a win for Canadians, but consumers advocates are skeptical. Freedom Mobile was already a player in the industry. Canadians pay among the highest in cell phone bills across the globe. Do you think a move like this will actually bring prices down in the long run and puts us on par with other countries?
Okay, it's a really important question. And, as I said a little bit earlier, I am very aware that affordability is a big challenge for many Canadians. It's an issue that the budget has addressed head on. And what we pay for our cell phones is a big part of our family budgets. Minister Champagne has spoken about this deal. The only thing I'll sort of underline from what he has said already is our focus is very much on Canadians. It's on Canadian consumers. It's on imposing tough conditions to ensure that Canadian consumers get the services they need at prices they can afford.
Okay, thanks very much, everyone.
Okay, merci beaucoup tout le monde. Thank you very much, everyone. And thanks also for people who have hosted me here. Everyone here does really, really incredible work. I felt really privileged to hear about it today. Thank you. Okay.
Nice meeting you.
Nice meeting you too.